Hello, I am Dr. Vivek Vardhan Veerapaneni, a consultant pulmonologist at Swasa Hospital, Narayanguda, Hyderabad. Today, on the occasion of World COPD Day, that is November 17th, 2021, we have a message for you. COPD is a disease of lungs. Our lungs are situated over here inside in the chest wall. They have millions of alveoli, that is the area that is involved in gas exchange. When you breathe air, it goes inside. Our lungs are just like a tree. So that air flows through the trunk, the branches, it goes to the tips. The leaves that are on the tree are just like the alveoli that are in the lungs. So these alveoli are the place where the gas gets exchanged. Carbon dioxide comes out to the air, whereas oxygen enters your blood. This is how we function. That is a major fuel for our body. So what happens in COPD? COPD, the tubes that we inhale, the caliber of the tubes, which is supposed to be like this, becomes quite narrow. Apart from this, those leaves, those sacs that are there in the tips of the branches, all those, there is a lot of disappearance. Most of them disappear and they get damaged. This is why COPD patients suffer with breathing difficulty, cough, and also phlegm. These are the major symptoms in these patients. So with this introduction, I would like to tell you more about COPD. Number one, COPD affects your lungs. COPD is the second most common cause of death in India and third in the world. So with this, you should understand that it's a major killer. COPD kills more people than malaria, TB, and diabetes altogether. This tells us the magnitude of the problem. COPD is increasing day by day in India as well as in the world. India has the highest cases of COPD and also the highest deaths. This tells us that this is a major problem. Following heart disease, this is a major problem. COPD patients experience symptoms like breathing difficulty, cough, and phlegm production, and also weakness, tiredness, because not only lungs but also many other organs are affected in their body. It's a systemic disease. Risk factors of COPD are smoking, any form of smoke, be it cigarette or BD or hookah, or even exposure to environmental smokes, occupational smoke, occupational dust, dangerous fumes, biomass fuels. All these can lead to COPD. And more importantly, even air pollution, exposure to air pollution for a significant amount of time can lead to COPD. Now, this is a very dangerous thing because India has the highest number of polluted cities. Top 20, if you take, we have almost 14 cities that are highly polluted in our country. So, this is very alarming. So, we should all be responsible, take responsibility of our health. And I will tell you what are the precautions that has to be taken by all of us. Unfortunately, COPD is a disease with very less awareness. Many people know about asthma, they know about BPs, that is hypertension, sugar, that is diabetes, but COPD is a less known disease by most of the people. This is one of the major reasons why GOLD conducts World COPD Day every single year to increase the awareness about the disease. This year the theme is Healthy Lungs, Never More Important. Following the COVID pandemic, we've all realized how important our lungs are. Our lungs are the reason we function every day. That is a place where the oxygen mixes into the blood. So we have to safeguard our lungs. Millions of people in India have COPD. Sadly, they don't realize that they have it because they don't even know that a disease like this exists. Through this video, we want to increase awareness amongst you. And we want you to recognize if any person who is suffering with chronic, that is long-term breathing difficulty, cough, and lot of phlegm production, who is very weak, very thin, who is a chronic smoker, and who is exposed to a lot of pollution or industrial gases, you have to identify as a responsible citizen and bring them to medical attention, be it a government center or a private center. It is better to identify because we as doctors only can see patients when they come to us. But you as public have the power to see them outside and you have the capacity to identify if the patient is having a breathing problem, cough, or any phlegm protection. It can be any disease. It can be COPD, it can be asthma, it can be ILD. So there are a lot of diseases, but whatever it is, that patient will get treatment because of you. So I think this is awareness. At Swasa Hospital, we strongly believe in patient education, promoting awareness among the public. Coming to treatment, COPD is a treatable disease. There is treatment. Treatment is with inhalers, with some tablets. This is medication part. Next is rehabilitation, that is chest physiotherapy and breathing exercises, which are also very, very crucial for treatment of COPD. Apart from this, good diet, nutrition is also extremely important because these people lose a lot of muscle, a lot of weight because of this problem. So this is a holistic way to approach a COPD patient. Last but not least, vaccination is extremely important in these patients. Vaccinating them for influenza vaccines, which will prevent flus. Vaccinating them for pneumococcal infections by giving 2 types of pneumococcal vaccinations. Vaccinating them for pertussis by giving Tdap vaccination, and vaccinating them with COVID vaccine to prevent COVID in these patients. So, and finally, a zoster vaccine, which is given for more than 60 years of age, is also recommended in COPD patients according to the latest guidelines. So treatment is not only taking just medicines, but also doing some exercises, taking some good diet. All this is a part of treatment in COPD. Coming to precautions. So you must be wondering, what are the precautions so that we won't get COPD? Avoiding smoking, staying away from smoke. Even staying away from people who smoke is very important because secondhand smoking or exposure to environmental tobacco smoke also causes dangerous lung diseases including COPD. And also occupational exposure of these noxious gases or dangerous smells or smokes also causes lung damage, thereby leading to COPD. Sometimes, rarely, patients who are affected with TB, following a long term, they may develop a disease like COPD called as TOPD. Avoiding significant exposure to air pollution is also a very important thing because air pollution itself can lead to COPD. So these are the multiple precautions that you are supposed to take so that you can safeguard your lungs. So finally, I would like to conclude saying, healthy lungs, never more important. So with this video, I hope you have understood the importance of having healthy lungs and what is COPD and what are the symptoms, what are the risk factors, what are the precautions. I hope you share the video so that more and more people get to know about this dangerous disease and gets treatment if they have this disease. Thank you.
We'll be covering all topics which commonly affect patients on a day-to-day basis.
For more this type of doctor advices or opinion or any other things,
దయచేసి డాక్టర్స్ అడ్వైస్ ఛానల్
లైక్ చేయండి, కామెంట్ చేయండి, షేర్ చేయండి.
సబ్స్క్రైబ్
to this channel, Doctor's Advice.
10 మందికి ఉపయోగపడేలాగా చూడండి. థ్యాంక్ యూ సో మచ్.